Good afternoon, ladies and gentlemen. Welcome to Lifestyle with Dr. Moby. I'm Dr. Moby, and today we have great guest Jack with us. Hi, Jack. How are you?
Hi, I'm good, thank you.
And Jack is all the way from UK. He's a podcaster, and let's hear from Jack. Jack, tell us about yourself.
I'm a podcaster. I've been podcasting for the past year. My background is that about 8 years ago, I was a homeless addict. Um, Suffered with mental illness my whole life. Um, got caught up in crime in my younger days, and now I sort of work with people, helping them understand their trauma. And I'm also a investigative journalist.
Okay, very good, very good. So tell me, what made you start on this career, this path?
Um, so like I said, I've suffered from mental health issues my whole
Mm-hmm.
life, and I was homeless. But I met my wife about over 8 years ago now.
Mm-hmm.
I was going to a food bank to get a meal, and she took kindly to me, and we started talking, and she took me out for something to eat, and took pity on me, and then we ended up getting together and getting married. I have a friend who's a hostage and barricade negotiator by the name of Jason Edwards. He's one of the top
Mm-hmm.
ones in Britain, and he said, "Let's do something." I'd been having some confidence issues. Um,
Mm-hmm.
I'd written a couple of books. I'd done a couple of UK-based Hollywood films, but I was having a few mental health issues, and he said, "Let's do a podcast." And that was on November the 9th last year, and I haven't stopped since.
Oh, that is great. So that is what a story. A lot of actual real life, right? So a lot of, but that proves another thing is there's always somebody made for you, or
Yeah.
somebody cares about it, right?
Yeah.
And
I-
I'm sure you never thought that you will be meeting this person.
Yeah, it was certainly against the odds. I wasn't looking for anybody. My marriage had ended a few years before, which is how I ended up homeless. And it's she wasn't even supposed to go to work at the food bank on that day. It was just a series of coincidences that put her there and put me there at the same time. And it was kind of fated. And she's been she's certainly been my angel through my mental illness, and I had a massive breakdown in 2015. I
Hmm.
got sober in 2014, but I had a massive mental breakdown in 2015 when I had tuberculosis, and I was in hospital for quite a long time, and she stuck by me, and we got married 2 years ago now, but end of November 2 years ago. So yeah, we're
Hmm.
doing all right.
Wow, that's great. Like match made in heaven. Huh?
Yeah,
That's
yeah,
very nice. That's very
yeah.
nice and very romantic too. So also tell me a little bit about what you do normally as an investigative journalist. You say you do as an investigative journalist.
Yeah, so I wrote my first book in 2016, which was it was a book about of poetry and about my breakdown and things like that. And then in 2017, I wanted to write another book, and
Mm.
I had a friend that was trafficked as a young girl, and I got talking to her, and then I made contact with some other people that had escaped human trafficking, and I ended up
Mhm.
spending 6 months working with them, and looking at
Mhm.
my own
Mhm.
childhood and my own abuse
Mhm.
through the teachers, some of the teachers at school,
Mhm.
and that's when I got into sort of the yeah, the difficult part of investigative journalism and looking at people that have been through some really
Mm-hmm.
harsh, difficult stuff.
Mm-hmm.
Um, so yeah, and then I wrote a book about it, and it's called Between the Streetlights and Red Lights. Um, I spoke to a couple of American survivors as well,
Mm-hmm.
and yeah, it's about to come out for a second run. The first edition sold out, and we're looking at bringing it out for a second edition as well. And then doing these podcasts, I started talking to ex gangsters, um, uh, alleged terrorists, bank robbers. So I got all sorts of people on, and I just started looking into that, and then actually becoming an investigative journalist. I work under the name The Accidental Journalist because I was
Mm-hmm.
never meant to be a journalist. I always wanted to be an actor.
Hmm. Yeah, yeah, no, but this is very nice that, you never think that you have that capability or you have that interest until you start doing that. And that is interesting, life teaches you a lot of new things if you are open to it, right?
Yeah, yeah.
Mm-hmm.
It wasn't expected. Like I say, I wanted to be an actor. I wanted to be a writer on some. So yeah, I wanted to write scripts. I wanted to get involved in films. And it was actually when I stepped away from that, and my pursuance of that I actually got into this, and then got invited to get involved as a consultant in a couple of UK-based Hollywood films, and then doing what I do now. It's spreading a message, talking about hope.
Okay, tell me a little bit about your acting career. You say you acted in few movies.
Yeah, so in 2017, late
Mm-hmm.
2016, 2017, I was contacted by a friend of mine who was working as a casting director out in rural Norfolk, where I live in the UK, and I was asked to go speak to a director by the name of Joanna Hogg,
Mm-hmm.
and she was making a film called The Souvenir Part
Mm-hmm.
One,
Mm-hmm.
and Tom Burke was uh, playing the lead. Tilda Swinton's daughter was playing the female lead, and yeah, I was asked to go out and speak to Joanna, and I was asked to speak to Tom and tell them about my life and talk to them about drug addiction. And then I got asked to if I wanted to have a small part, so I played Ray in the film. And then less than a year later, I was contacted to go and do part two, which is now out in the cinema. Um, to reprise my role as a cameo,
Mm-hmm.
and also speak about mental health to some of the cast. And they were funded in part by Martin Scorsese. Um, and then I did a little bit for the Discovery Channel. I played one of your American serial killers by the name of John Eric Armstrong, um, for the Discovery Channel. And I also played a corrupt policeman last year for the same company. So yeah, I've been quite blessed that when I thought I was not gonna do acting anymore, I started doing it. And then after I did that, I thought I'd make my own little film. I made two short films, both of them multi festival selected, award selected films, short films, and they're available on my website, jwgreg.wordpress.com. And yeah, it's been a sort of a journey to find myself, find who I am, find who I am as a creative. Um, Creativeness has always been um, a cathartic exercise for me, but creativeness also, on the flip side of that, has caused some mental health issues. So it's kind of a bittersweet story, really. But yeah.
Thank you for sharing that all. Also, tell me a little bit about mental health. What is important about that for people to understand, why we should really emphasize on mental health.
Well, nobody else is going to take care of your mental health for you. You know, the difficulty I had was that I was supposed to be a strong man. In my life, I've been a bare knuckle fighter. I've been a debt collector. I've been the epitome of toxic masculinity. And I could take any sort of punch, pretty much any sort of pain, but mental pain I'd never been able to take. I've suffered from mental illness my whole life, and the problem was that I used my mental illness was set off by childhood trauma, and then from that I used drugs to medicate and to try and not feel. And then I almost lost everything. And, it's taken a long time to build it all back up. But I know that I could lose it straight away again if I picked up a drink or drugs. I needed to look at my trauma in detail. I needed to pull it apart, and I needed to find out the reasons why I acted the way that I did. Because if we don't look at our trauma, we don't get better. And if we don't get better, we get addicted to those same old behaviours. And those behaviours are the things that drag us down. It's that self-destruction, that self-sabotage. You can't solve anything by picking up a drink or picking up a drug, which I thought you could. And for 30 years, I tried that, and it it never worked. So we have to look at actually, instead of trying to change our surroundings, we have to change what we think and how we see mental health. And it's perfectly normal for a man to go through mental health problems. It's perfectly normal for men to cry. It's perfectly normal for men to not understand things that people say they don't understand. We need to tackle this toxic behaviour of, people saying man up, sort yourself out. It doesn't work that way. It doesn't work that way. A wound can be bandaged. A gunshot wound can be packed. A bruise can be iced, but mental health, that'll kill you quicker than anything else. I've lost 7 people to suicide this year because of toxic culture.
Yeah, that's very sad. And yeah, I think a couple of things important here. What you're discussing is, people, first of all, they expect men to take everything and just not cry and not ask for help. But I think that definition has to be changed in a drastic way, because we all need help. Nobody's perfect. Neither I don't think only creator is perfect. So we can't be perfect. And you're absolutely right. Suicide is still the biggest threat beside illness, and COVID is not helped that portion at all. People are more sad and depressed post pandemic. This will create so many ripples down the road. People lost job, people are depressed because they were inside, and that is going to take a lot of toll on human life.
It does. It does. When Britain went into lockdown, I suffered. Um, you know, and I couldn't really do anything. But this past few weeks, I contacted COVID myself, and my wife has it at the minute, and it's a really difficult thing to go through. It's really tiring. It's really painful, and it's just it put me on my back, and I'm quite a strong person physically, and My wife is disabled, so it's I can only imagine how it's um, affecting her. I can't physically be. It was a hard 10 days because I'm not a sort of person that likes to stay in the house. I like to be out working in the community. I like to be out working with the church. I like to be out volunteering. I like to go out and go and shopping and things like that. So when I can't do that because I'm not allowed out of the house because I'm in isolation, that still affects my mental health. It still takes me back to my younger days. It still takes me back to my first time in a prison cell. It still takes me back to those old, difficult feelings. Um, and, you have to realize that with mental illness, that prison or, isolation isn't just a cell. It's in your head as well. Um, we lock ourselves up in there, and it's difficult. It's difficult for anybody. I know people that would be classed as some of the strongest men in Britain, and they've all suffered with mental illness. They've all suffered with depression. They've all suffered with anxiety and a lot of anxiety. Um, and they will all admit that they've been crippled by fear and they've been crippled by guilt and shame, and these things you know they poison us, and we don't realize it, because we kind of hide it away, we lock it away, um, and it always catches up with us, and then it'll put us, by the time you know it, you've been sectioned under the Mental Health Acts. So it's my job it's my civic duty
Mm-hmm.
to do things like this to educate.
Yeah, well, I think you're doing phenomenal job by doing that. First of all, it takes a lot of courage to come out and say that. Second, to share your story. Third, congratulations on your success. And your success fuels others to listen to you and also fuels others' successes. So, I definitely, great job you're doing. Also, I want to ask you, share with us things which you found were helpful through when you were dealing with your mental health. What things helped you?
Um, Faith, um, family, and friendship. I was I weighed less than I weighed about 79 pound. I was in a hospital bed. Um, I'd had tuberculosis because of the life that I'd lived. My lungs had failed a couple of weeks before. I'd stopped breathing for around about 4 minutes. I ended up with brain damage through hypoxia. The drugs that they had me on, they were hallucinogenic, visually, auditory. So I became convinced that I'd caused the end of the world with this. I was convinced that I caused a pandemic, which is kind of bizarre to say in this day and age, but, and I thought I'd ended the world. And I had people from my church come in and, despite me shouting at them and screaming at them and trying to hit them, because I didn't know what was going on, they sat and they gave me love and they prayed with me, and they just showed me some real love and some, that they were, family. And so when I started coming round and I started getting better, um, I attribute it to finding Jesus. I met Jesus at the end of my bed, um, and that has been sort of the biggest help. And then through that, then looking at the traumas that I'd been through, looking at my mental health deeply, learning to learning to push forward a trauma-informed society, speaking about my life, speaking about the way that my head works, speaking about the things that I've been through that are tried and tested. Um, I find it all cathartic. It's all cathartic. It's all healing for me. And I know that God took away my yearning for drink and drugs. I was heavily addicted to crack cocaine. I was heavily addicted to alcohol, and I couldn't, by my own steam, stop until And I said, God, can you take this away? And He did. And I had 6 or 8 months of a good life before my mind broke again. Because I didn't look at the trauma. It's not just the drink, it's not just the drugs, it's not just the disease of addiction, it's the things in our past that we need to look at. Trauma is one of the biggest killers of people to do with mental health, because a lot of people can't focus on their own trauma. A lot of people don't know how to deal with their trauma, which is why they end up with PTSD or CPTSD. And actually, to get better, or even just to stay in recovery at a certain level, we need to be looking at our traumas. So the first one for me was the trauma of being told I was adopted at 8 years old, which gave me a fear of not knowing who I was. It gave me a fear of rejection. So it was learning that, and then it was looking at the traumas of my sexual abuse with adults at school, and the reasons why that they did that, and it wasn't anything that I did. And you have to know that if you've gone through sexual abuse, it is never, ever, under any circumstances, your fault. Especially when it comes to adults doing it to you. And I thought it was my fault. I thought that I did something, and these adults led me to believe that it was me. And for years, for nearly 40 years, I carried that in my heart.
Mm-hmm.
Trauma of losing people to suicide. My best friend threw himself in front of a train in front of me. In recovery, my niece was murdered. My 2-day-old niece was murdered by her father.
Mm-hmm.
My sister's partner, who in turn was murdered in his prison cell. So I've gone through some real deep-rooted trauma, both in and out of recovery. But the thing is, I now know how to deal with my trauma. And yes, sometimes it means that we need to look at, taking the pills that the doctor tells us that we should take. It means looking at some of those things that are deeply uncomfortable. It means looking inside ourselves. It means learning about ourselves. And it means facing some real giants. I've been very, very blessed in the fact that I have some really, really strong people around me. I have a quite strong wife. I have strong leadership at my church. I'm part of the Alpha team. I'm part of what we call the School of Supernatural Life, which was designed by the Bethel Church over in Redding, California. So we've got something that's based on that. And it's about furthering our journey with God and, in faith, by facing giants. And sometimes giants are those traumas that have put us down on our backsides for many a year. Sometimes those giants are sitting in a garden shed, like I'm doing now, talking to people like you about a life of difficulties turned around, and I was told I'd never be anything. I'd never amount to anything. I'm now proving people wrong.
Well, I'm so blessed that you are coming here and giving us your take, and it means a lot learning from you. And people don't realize, but answers are always simple. I mean, solutions can be, you can, there are always multiple solutions, but your answers always most of time lie within you or next to you or around you, but you don't look at them because you're preoccupied with 10 other things. Absolutely right about stopping drugs, alcohol. A lot of people, unfortunately, because I see a lot of patients, they try to self medicate with alcohol or with things which never help. um, Although their treatment is very simple, is talking to their loved ones or close friends, and that's all it takes. Once you get a support system, there will always will be few good one which you never thought they will, and they can actually come and help you. Like you said, you never thought you were going to meet your wife, current wife, and she happened to be that day. You remember? If it was you and me calculating, it would be beyond our calculations, right? So those are all good things can happen, but you have to believe in miracles, and also you have to have a positive approach. Once you do that, I mean, mind is a beautiful magnet in terms of it attracts good and bad. But so if you attract good things do happen. So that's my take always on that, because brain is like that. It's going to, if you're happy smiling, you can feel 10 other senses, but if you're sad and depressed, unfortunately you don't feel anything but yourself. So that's the bad part about it. um, I think congratulations on your success, and we look forward to have more books and more podcasts and more interviews for you, and come back anytime and share your success on Lifestyle TV.
I will. Thank you.
Thank you. Okay, with this, any final thoughts or message you have for my listeners?
Yeah, if you are suffering, don't suffer alone. There's always somebody out there that will listen.
Hmm.
If you need to speak to somebody, speak to somebody. If you need to drop me a message, find me on Facebook, The
Hmm.
Accidental Journalist. I'm the only one on there. And I'll quite happily speak to you. But get help. Please, don't suffer
Hmm.
alone.
Hmm. That's true. Okay, with that, thank you once again for coming to our show. Take care and good night.
Thank you.